designed to treat us every time we get sick.
Acutely, it's incredible for that. If I'm in a car accident, I'm going to go to the hospital and have them look at me, reset broken bones, and fix the organs. But if I want to heal up afterward, then yeah, there are other medicines that do that a little bit more effectively. Yeah. Does everybody have to go now?
Are there questions or comments?
I do. I find it always incredible when you, and on the TV they have these ads about, you know, if it's, inflammatory, right? You kind of, I have a back pain, I pop the pills and then I can, carry my grandchildren. It's like, I always cringe because it's exactly the, just, get rid of the symptom kind of thing and then ignore your body altogether and do stuff that it told you not to do, right? But yeah, so but the problem is, if I go to my regular, health care provider, then I have a pain, and they say, well, take some Advil kind of thing, and that gets rid of the pain. Where I'm thinking, but it's got to come from somewhere. So then it's frustrating that then they don't look kind of well, or they just incapable of. I think. I mean, it's not that they're don't think that I have pain. But the only way for them to deal with it is to say, take the Advil, and they're not capable of looking. They have really no other means. I mean, it's
it's
amazing.
a little bit limited. They might be able to refer you for X-rays or CT, or if you're in a lot of pain and those imaging results have come up with almost nothing, maybe an MRI. But if those still come up blank, and they do blood work, and the minor blood work that they are able to do, it says maybe you don't have any inflammation, well then you're kind of on your own and you rely on these drugs. And they're a great means to an end, but if we stop there, there are a lot of consequences. And the drugs have a lot of side effects because in some ways they get rid of inflammation so well, and we need a certain amount of inflammation in some parts of our bodies, like NSAIDs, naproxen and that kind of thing, the major painkillers. They cause gut problems and gastric bleeding because they erode the mucus lining in our gut that we put there to protect us from our own stomach acid. So sometimes even using another kind of medicine like naturopathic medicine or functional medicine can just help you delay or limit the side effects of pharmaceuticals if pharmaceuticals are the option that somebody wants, but still a variety of options on a continuum.
I feel kind of fortunate because compared to a lot of people anyway, because I do have a family doctor who I feel doesn't rush me.
Yeah.
So at least I don't feel like, he's just thinking about his next patient or whatever. So that is a plus. And he does listen fairly well. But what he doesn't do, and what I think integrative medicine does do much better, is ask the right questions and probe even more, because I often feel like I don't want to be a complainer. That's my biggest problem probably when I go to the doctor. So I tell him the few little symptoms that I have or whatever, but I without prompting won't go beyond that to explore it further. But if I had someone who would ask the right questions and put some pieces together, then we could get much further.
Yeah.
So that's the benefit that I see.
A lot of physicians, I think, even if they are interested in helping somebody understand why or more deeply where is it coming from, they're part of a system, and this is the political part of the difference, part of a system that rushes them inherently. They're paid only a certain small amount of money per patient, and I've been told, it's just enough dollars. You have to see at least 6 people in the hour to make your overhead, generally for a physician in Ontario. If somebody cries in your room, well, you've not made enough money that day to pay your bills. And it seems unrealistic to some people, but it's part of the system. I think it's very stressful. I don't envy the majority of family doctors in Ontario or Canada in general, the way our system is set up. There's so much pressure on them, they can't listen. And so we see more and more going into private medicine, and the idea of private medicine is now a dirty term because it's about us or them sometimes in politics. But if we could really integrate the different concepts and help people access medicine that allows them the time they need for those educational pieces to explore their own philosophy in medicine, what do they need, what is their pain or their health concern telling them, it would be quite a different world. think about how happy people could be and what we would do, the consequences. Yeah.
It's also a much more litigious environment.
Hmm.
So the consequences of a wrong diagnosis or an argument that proper care wasn't taken
Yeah.
has to be on the mind of every physician.
Yeah.
I'm kind of interested in that in terms of naturopathic medicine.
Mm-hmm.
Doctors carry huge amounts of insurance to protect them
Yeah.
from mistakes that mistakes happen. That's the way it is. So is that a concern in your field too?
Every licensed profession in Ontario at least does have to have malpractice insurance. Usually it's a $2 million liability up to $5 million liability kind of thing. It's just a government requirement. But I don't know of anybody who's really had to go through that process, really use that. The rates are so low in for licensed health professionals who are part of another medicine, in part because a lot of the healing comes from developing that relationship and that trust with a person. If it's not a good fit between patient and practitioner, or client and practitioner, if you will, that client's going to go somewhere else, and for good reason. It might not have anything to do with the quality of care. It's just the fit has to be important and the trust has to be there. So the environment's entirely different. And a lot of it is a consultation practice. It's about providing information and options. And that's one of the reasons why I enjoy working with women so much more, if I'm allowed to say, than sometimes men, because I can say, here are some options the way I see it, from the most difficult for you to the most easy, but maybe more expensive or not as quick or whatever. You know, looking at the various options and saying, what works for you? What fits your lifestyle, your needs right now? And that takes a lot of the onus off the practitioner, which has some side benefits for the legalities of practicing, but I think more importantly, puts the onus back on the person. They have to decide what feels right to them, what works with them. Yeah, it's all part of the bigger picture. Yeah.
I mean, there's a fine balance too, right? Because I mean, mainstream medicine will do that too, in a sense of, you know, we let's say a pregnant woman will get a genetic test done, and then get sent home, basically make the decision what you want to do with that. I mean, given maybe some information, but generally not a lot, right? So this kind of idea that, I mean, giving options, yes, but they also need to be, in a sense, well-founded or connected to the person, right? Like that they really are their options, and you're not back to, statistically speaking, you have a chance, now go make the decision. Well, I'm not a population, I'm a person, so what does that really, so anyway, so that kind of is missing, right? But anyway, so
we don't have the
there's
infrastructure for that proper educational process. Is that what you mean?
Well, I think that mainstream kind of does that, will also kind of put the burden, in a sense, on the person to kind of say, it's your health, you make the decisions, and to sit, like the same I find with this mammogram and stuff. I mean, it's one thing to kind of put it back onto the person to decide these things, but without really proper context and consultation, we are not able to make those kind of decisions. And I find that often mainstream healthcare now does that, like they throw the ball back, but really we're not in a place to make informed decisions.
Without the capacity to really look at the individual and say, well, here are your risk factors specifically. I see that all the time with breast cancer, for example. We are counseled to have a mammogram because, statistically speaking, this number of women are going to have breast cancer, and this number of women are going to have these kinds of outcomes. But what we don't have the opportunity to really consider is the individual risk factors. What is your estrogen balance? What is your exposure to electromagnetic radiation? Because now we can see some direct links in the research for that as a risk factor. What about your social network? What about your stress level, cortisol, thyroid? All of that stuff affects breast cancer, and we can measure that stuff, and we can put it together and look at you as an individual. Is this a serious issue, risk for you or not? And that's what we're lacking, that kind of counseling.